Hello. I'm Julie Evenson. I am engagement editor for the Oregonian Oregon Live. I am here with Dr. Bina Mehta from Kaiser Permanente. Dr. Mehta is a pediatrician at Kaiser, and you have been there for quite a while, is my understanding. Is that correct?
That is right. 20 years.
Wow. So, what we're going to do today, we do these Q&As frequently with readers and viewers on our social platforms. And today we are going to talk about COVID vaccinations for children. Kids ages 5 to 11 have just recently been approved to get the Pfizer vaccine. And we obviously, as you might expect, we get a ton of questions from parents. What should I know? What should I be thinking about? How do I talk to my kids about this? So that is what we are going to do today. I think the biggest question we've gotten, and something to start with as people are joining us, you can see those numbers going up in our live watchers there. The biggest question we get is, aren't kids pretty safe without the vaccine? What's the reasoning for not just getting it, but getting it quickly? Like, why is that the guidance for parents?
So yeah, thank you for that. I think I wanted to let people know that I'm a pediatrician for the past 20 years, but I'm also a mom. And, I understand what people are thinking. I'm talking to parents every day about this. And I'm just really excited to kind of talk about it with a bigger audience today and just share with you some information and also sort of my kind of synthesis of that information. So when we're talking about vaccinating kids in this age group, the 5 to 11-year-olds, yeah, there's been a lot of talk about how they're at lower risk than perhaps seniors. And that is true, but the risk is still concerning. And I would say the reason to vaccinate these kids is a couple of different reasons, really. It's kind of divided into two different sections. One is really their individual risk and how they need this to sort of help lower their risk. And so I think it's helpful sometimes to understand risk by comparing. And so to put it in perspective, if you compare it to something that we know, for example, seasonal flu illness. Every year, seasonal flu comes around, and about 200 pediatric deaths occur every year from seasonal flu. We have a universal vaccine recommendation for seasonal flu. And COVID thus far has caused about 700 deaths in kids so far. So that's a pretty stark kind of number and sobering number. And if we kind of boil it down to just the 5 to 11-year-old group, which of course we're more focused on today because that is the group that just got approved for the vaccine, I want to share with you another set of numbers. More than 1.9 million cases of COVID in that age group, the 5 to 11-year-olds. More than 8,300 hospitalizations. More than 2,300 cases of multi-inflammatory syndrome in children, and 94 deaths. So this age group is susceptible to getting COVID and getting seriously sick or dying from COVID. The other piece to this of why to vaccinate my kid is a community reason. Kids get COVID and kids spread COVID. Vaccinating kids is a crucial step in getting to herd immunity. And I think kids and adults want to be part of a community that protects them and that they also protect. You might ask yourself, like, how awful would it be to know that they infected someone who then got seriously sick? That could be a classmate, it could be a family member, but that does not sit well with most people. And then zooming out a little bit, I kind of want to think about this long pandemic. It's been really long,
Mm-hmm.
and it's taken quite a toll on the kids. Our children have been like innocent bystanders in this pandemic. Um, they've been excluded from so much of normal childhood. And you can tell I'm getting a little choked up, you know? And
Yes.
that's because I see them every day and I see that there's been suffering in learning, in development, in physical and mental health. And they're still being excluded now from school when they're ill or when they're exposed to someone who's ill. Um, so vaccinating these kids is sort of a crucial step for getting back to normal, and they deserve that.
Yeah, that's great. No, I was reacting to you. I Full disclosure, I am a parent of a child in that age group, and yeah, you're right. Like it's been really tough on kids. It absolutely has. I'm going to pause for just a second because I see that we've actually had quite a few people join us. Um,
Mm-hmm.
I'm going to remind everybody who I am and who you are and why we're here. I'm Julie Evenson. I am engagement editor for the Oregonian Oregon Live. I'm here with Dr. Bina Mehta from Kaiser Permanente. Dr. Mehta is a pediatrician, and we are talking about why should we be getting kids vaccinated now that that's available to kids ages 5 to 11, and then also taking some questions about some of the concerns that parents might have, the things that might be giving you a little bit of pause, or things that you just don't know the answer to. And anytime you're talking about your kids and their health, that is top of mind for parents. You want to make the right decisions. So I think one of the things that we hear people ask about a lot, and I'm already seeing a couple of questions in our comments live here about this, is vaccine side effects. But also, to tee that up, COVID has side effects for young kids too. So can we
Mm-hmm.
talk about both of those things and how parents should assess risk and what they should be thinking about as they're making that decision?
Right. And so we kind of got into some of the numbers before about risks of getting COVID. And so we know that these kids get COVID, they spread COVID, they get seriously sick from COVID, and some die. But when we talk about side effects, and specifically now with the new age group and the clinical trial for that age group, the most common side effects are what you would expect. So soreness at the injection site, fatigue sort of generally, headache, and muscle aches. And most of the time they last a couple days. And then that's it, they're back to normal. But I suspect that some of your audience might also be asking about a rare side effect they might have heard about in older kids, actually. And so myocarditis, which is inflammation of the heart muscle, is a rare side effect that's been reported in older kids, so older than 12, and young adults. It's more common in boys. And in this younger age group, in the clinical trial for this younger age group, there were no cases of myocarditis in the about 3,100 kids vaccinated. Now, it should be noted that the trial wasn't powered to assess the rate of rare events, but kind of circling back to your point, cardiologists say that the risk of myocarditis from COVID infection is actually greater than the risk of myocarditis from COVID vaccine. So that's a really important point. Not everybody knows about what myocarditis is, as well as how it's connected to actually the COVID infection. So that should be noted, that it's basically a much riskier to be unvaccinated and then acquire COVID infection, and then the risk of myocarditis would be then higher.
So with that, and noting, of course, that it is a rare side effect, but parents worry. What should parents watch for if if that's a concern for them and they want to make sure that they're keeping an eye on their kid post vaccination? Like, what are the symptoms of myocarditis?
Great question. So if they had shortness of breath, chest pain, irregular heartbeat, that's something you would want to call your pediatrician about.
Great. And so most parents, though, to restate what you said earlier, most parents should just be watching for, a little soreness and some fatigue. Um, there's been some conflicting information out there about what you can give adults or children after the vaccine to help deal with some of those minor side effects. Can parents give children's Tylenol? What's the guidance there?
Yeah, most of the time, a cold pack to the arm if it's sore, and sort of your usual TLC, with distraction and love there is enough. But then using Tylenol is reasonable if you feel like they either have fever or pain that really requires some more relief.
Great. So we've got a really good question here from Trina, who is a teacher. And this is actually something that you and I talked about a little bit before we did the interview of, how to talk to kids about the vaccine. Kids are often scared of needles. They may have questions, why do I have to get this? What do you say in your practice to kids and parents? How should people be thinking about talking to kids about vaccination?
Hmm. Well, it is, of course, super common that children are going to be scared of needles. That everybody knows that, and that's okay. That is totally fine. We work around that. And just like other vaccines, there's a lot you can do to help. And so I would say towards parents, um, they take their emotional cues from you. And so if you show them, you sort of believe and show them that this is the right thing to do, they can sort of take that from you, take your emotional cues and be brave. And I think it does start with some honesty, though. Tell them that you're taking them for their COVID vaccine, and make a plan with them that you're going to, have a plan for distraction during the vaccine and celebration after the vaccine. And some things to consider is you could kind of practice taking a breath with them and letting it out slowly, and teach them that that loosens the muscles in the body. And when you loosen the muscles like that, actually the sharp shot hurts less. Another thing you can think about doing is choosing a song ahead of time or a video ahead of time to play on your phone,
Mhm.
and use that as distraction while they're getting their shot. Um, and another idea is like hold their hand, kind of lock eyes with them, and maybe ask them to name all the kids on their sports team or all the seven dwarves or whatever set of characters that they like. And that might be, more of a secret quiz kind of thing. So I'm going to hold your hands, I'm going to look at you, and I'm going to ask you a quiz. And
Right.
you're going to know the answers, and they'll be like, oh, what's the quiz? Well, I'm not going to tell you now. And so again, you're making a plan with them. And then afterwards, regardless of whether there are tears or not, make sure you celebrate. Select a fun activity that you're going to do afterwards.
Great. And that's a good segue then into this is another question. We asked parents for questions ahead of this interview. Um, where is the best place to take kids, given that, not everybody will have the luxury, obviously, of choosing wherever they want to go, but, a pharmacy versus your pediatrician's office versus their school. Is there a best choice, or is it kind of dependent on the child?
Yeah, I think it's a lot more dependent on the child. Certainly, if you have the convenience of your pediatrician's office offering it, that sounds wonderful. But there are a lot of options. And so it might be actually easier that it's the local pharmacy down the road where it's maybe
Mhm.
really easy to get an appointment. As well as some of the schools in the area are going to be holding vaccine clinics. And so that might be super convenient and also might have a nice vibe to it where it's everybody coming in to the school and sort of being excited together and sort of doing this together and getting that sense of community. So that might have a bonus sort of points to it that some families might like, some kids might like. So I think it just is an individual family decision. I don't know that there is a right or wrong decision, but I think, convenience and ease are probably top of mind.
Yeah, That makes sense. And we've got some links. I'm seeing some questions here in the comments live that are things that are maybe a little bit more detailed than we're going to get into in our talk. But we've got some links about specific places. Portland Public Schools is offering clinics. I know the Reynolds School District is offering clinics. And then some of the other places around the metro area and around the state that parents can go to get vaccinations. We will put those links in the comments here after we're done. And then there were some specific math questions about, risk of myocarditis. That's all stuff that we can follow up later. We've got great documentation. There's all sorts of great data out there that our COVID team at the Oregonian has been collecting. So I'll make sure that everybody's questions get answered in detail if possible. So if we don't get to your question live here verbally, we're going to follow up in writing after the fact. All right. So another question, a series of questions that we got actually were about the children's doses versus the adult doses. What are those differences? I know, the needle is going to be smaller for kids. The dose is a little bit lighter for kids. Are there other things that parents should know about the differences between the children's dose versus the adult dose?
I mean, those are the big ones. It's a third of the adult dose, and it's also a smaller needle. And so it's kind of a lucky piece there that we get to kind of offer them protection with less dose and less pain, and they get to kind of join the herd of immunity. So those are the main differences, and the packaging will be different. I believe it's orange packaging for the children's dose, and the adults, I believe, had like a purple color to the cap. So a little bit different that way, just in terms of recognizing which is which.
Right. Make it really easy.
Mm-hmm.
So then a follow-up, in that same vein was for parents of children who are 11 or 11 and a half, the 12 is the cutoff then between the children's dose and the adult dose. And it's a fairly significant difference. The children's dose is only 1/3 of the adult dose. What should people be doing? Should they wait, or should they go ahead and get that 11-year-old dose now?
Okay, so short answer and then long answer. Short answer is get it now. But long answer is that's exactly the question we asked of the experts. The obvious question that everybody has, because you wonder if maybe bigger dose equals better protection. And that isn't true. Bigger dose doesn't equal better protection. And so they've studied that well enough to know that in this 5 to 11-year-old group, even at the cusp of 11 and change, that they are mounting a good immune response that's equivalent to the older segment of like older teens or young adults. And so you're getting essentially everything you want in terms of response from a third of the dose. So it's kind of a win-win, and even amongst ourselves as pediatricians, as we were first learning about it, we were like, oh, should we wait? And the answer is absolutely do not wait. Get in line, try to get that appointment as soon as you can, because you want to get that immunity going soon. And hopefully then if you got them the first dose pretty soon, then by winter break, your child will be fully protected. So that, in addition to knowing that, we have a really significantly high prevalence still of COVID infection, it's just kind of getting on the appointment schedule and getting things going is really kind of a time sensitive thing.
Great. I suspect that your answer to this next follow-up question will be similar. But the other question we got about timing, and we saw this pretty frequently from parents, was, should I wait and see how this goes with the first group of kids who do it? People are cautious, and I totally understand that. So how do you respond to parents who are like, well, maybe I'll wait 6 months and make sure it's okay?
Mm-hmm. Yeah, I mean, I can understand that thinking to some extent, but I think that when we're talking about we are in the thick of it right now, it is hard to wait. In my opinion, I think the children have waited long enough. They have been standing by waiting. The process to determine safety and efficacy of vaccines is rigorous. The bar is set really high for using vaccines in healthy children. In fact, when many parents were impatiently asking me about this vaccine in the summer, when's it coming for my 8-year-old, hoping to get it before the school year started, the study actually enrolled more children and studied it longer to be sure it was safe and effective. And this had the unexpected benefit of overlapping with that Delta variant surge. And it showed a more than 90% reduction in infections. And then the risk of delaying is real. 90% of counties in the US are still classified as having high or substantial virus spread. So we're still in the thick of it. We're more indoors now with the cold and the rain coming, et cetera, and celebrations at the head. And I think they need their protection now.
Great. So those are the majority of the questions that we got that weren't, math, which, like I said, we will follow up with some links. We've got some great data for parents who, maybe want to dig in a little bit more. We've got some charts and graphs. I'm a charts and graphs person, so I know that that's helpful for me when I'm making decisions as a parent. But before we wrap up, is there anything else, something that you'd like to revisit from the top of the broadcast when, we didn't have quite as many people on, or just a general message that you'd like to be sure we touch on before we say goodbye to everybody?
Yeah. So, it sometimes helps to understand that we really are all in this together. And, we as pediatricians, we're humans too, and we have families too. And living through this long pandemic, as we've seen these vaccines roll out and seen how beneficial they have been, we just sort of approach that with gratitude and excitement. And in my pediatrician chats, every system has their own chat thread and such, and there's been just so much excitement and gratitude for this vaccine. And I think it's time that we give this to our next age group that's eligible, and so these 5 to 11-year-olds. So I guess that's it. We as pediatricians, but also parents and aunts and such to our family and friends. We give the advice of let's get this done together. So I hope that's helpful to the audience today. And if you have any further questions, you might want to have a discussion with your own child's pediatrician, someone you already know, you trust. And just kind of take that a step further in your discussions.
Great. Well, thank you for spending some time with us today. Good conversation. I appreciate it. For those who maybe are watching this later, we're doing this live right now, but it's going to be up and available on our Facebook and our YouTube. If you have questions, specific questions, still put them in the comments in the chat. We will, like I said, we're going to come back later and we're going to answer some of those other questions in writing that we either didn't get to or we didn't have all the stats available here right at hand. So, if you're watching this later and you still have questions, we'll still be here to answer them. And thank you again, Dr. Mehta. This was great. I'm going to go ahead and wrap up, but I really appreciate your time.
Thank you. This was fun.